Focus on Abilities is brought to you by Tier Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence. In the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.
Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm Lex Frieden. I'll be your host for today's program. I'm professor at the University of Texas Health Science Center at Houston, and I direct the Independent Living Research Utilization Program, ILRU, at Tier Memorial Hermann. Today we have a special guest on Focus on Abilities, whom I will introduce in a moment. First, however, I want to ask you a question, one that we will answer before the end of today's program. Many people with severe disabilities and those who are aging with disabilities prefer to live in the community rather than in an institution like a nursing home if they have health care needs or needs for attendant care. What's it called when we try to develop an infrastructure for support in the community? We'll answer that complex question in this segment coming right up. Stay tuned. Thanks for tuning in to Focus on Abilities today. I'm Lex Frieden, and our guest today is Merrill Friedman. Merrill is a national disability advocate. And Merrill, it's a pleasure to know you, and it's great to have the opportunity to speak with you today on Focus on Abilities. Thanks for being here.
Thanks for the opportunity, Lex. I enjoy my friendship with you, and I look forward to the conversation.
Now, you are, I referred to you as a national advocate, but that's the kind of your functional job. Your day job is working for Anthem, an insurance company, and your title there is what?
Senior Director of Disability Policy Engagement.
Okay, well, too long to fit on the screen, so we'll just call you a national advocate.
And that probably fits better anyway.
That'll be the basis of our conversation here today. At the top of the show, I asked a question. I said people with disabilities and aging people who need help living at home. And the reality is data shows that 98% of people who are aging want to age in place, and I'm pretty sure the percentage among younger people with disabilities would be the same. Right. However, many of us need help as we grow older, and certainly if we're younger with disabilities, we need some help where we live. And the only real institutionalized opportunity today is a nursing home. And perhaps other kinds of institutions, but most people want to live at home. They want to live in their own space. They want to have their own stuff. Older people want to enjoy the benefits of the privacy, the amenities, and the personal space that they've worked so hard to earn. And yet we don't have an infrastructure in this country to provide those services. The question I asked was, what do you call that? What do you call that infrastructure? And you know the answer.
I can't give it away. I think you told me. I can't spoil the secret. You know, we often call those long-term services and supports through home and community-based service programs. So if we did that all in acronyms, it would be, you know, LTSS within HCBS. But it's really ensuring that people have the services and supports they need for the duration of the time that they need them, whether it be, you know, 5 years, 5 days, or 98 years or whatever, and that they can do those in their homes and communities.
Well, that's the most concise description of long-term services and supports I think I've ever heard. Just to be clear, so people who are watching understand, we're talking about long-term services and supports. That's the answer to the question. That's what we need in the community in order for people with disabilities who have needs for assistance and aging people who prefer an alternative to a nursing home. That's what we need. Now, Merrill, many people are receiving those services through family members. Some people who are eligible for limited government state-sponsored programs receive those services through that sponsorship, and other people have the means to hire home health aides and personal caregivers, and we call them personal assistants or attendants sometimes. But that's a really kind of a awkward way to manage a system. It's a non-system. Do you have an answer to that? I mean, can we systematize that? Is there a better solution?
So, I think that when we look at people being able to self-direct, which is very important for people with disabilities, to be able to pick and choose the people who are providing services for them, and pick and choose the services that they need and that they want, that are meaningful to them. And so I think that...
Yeah, I want to interrupt you there.
Please
because
do.
I think that's an important distinction. Usually when I talk about long-term services and supports in the community vis-a-vis services one might receive in a nursing home, I don't really emphasize the point you just made. And I think that's sentinel. In the community, one of the things that's different, besides the personal space and the privacy and all of that, is the ability to direct your own services, to direct your own care. If you're living in an institution or a nursing home, somebody else is the boss. You're sort of, you don't choose who's going to come and feed you, bathe you, help you dress. If you're living at home and managing your own services, then you actually are independent in the sense that you make the decisions that affect your life.
Right, and I think that's what most people want, and we believe it's a fundamental right, within these programs. And I think that managed long-term services and supports through these systems, that we talked about, should be the impetus for expanding, access to self-directed options. I think we've seen, the trends and the information and the results, directly from people who get to do that. Right, that people who can pick and choose the services that are important to them actually use fewer services.
Well, in Texas, we have a program called Star Plus, and some of the beneficiaries of that program, I think they have to be Medicaid eligible, but some of the beneficiaries there qualify to be part of a demonstration program, a model program that includes self-directed services. And so the company that's responsible for implementing the program facilitates the hiring of people who are chosen by the one who needs the help and directed by the one who needs the help. That's, to me, kind of a model program. In fact, I asked one of the executives of the company that facilitated those services if they could provide that service to people who were not subscribers or not eligible for that particular program. And it hasn't happened yet, but I'm hopeful that that will come to pass someday. Is that possible?
I think it makes sense. I think, there are roles, and I think, people with disabilities can build those programs and become entrepreneurs, and run those, because they know the value, of how integral that is to a person's ability to get up in the morning and get going and be where they need to be and raise their families and do the things that they want to do. So I think those are great opportunities, to expand the capabilities. And I think we all know, when we talk about home and community-based services and people being able to access them, we still need a lot of capability building, in the communities.
Let's talk about that more.
Okay.
Please stay tuned. You're watching Focus on Abilities. Merrill Friedman is my guest. I'm Lex Frieden, and we'll be right back. You're watching Focus on Abilities on HTV. Our topic today is long-term services and supports for people with disabilities and seniors. And our guest is Merrill Friedman. Merrill, there are a lot of challenges, as we've mentioned, to trying to live independently in the community if you do need help, if you are a senior. Obviously, if you're a person with disabilities as well, family members are often helpful, but in reality, family members have their own lives. They have their own families. They have their children they need to care for, or if they're younger, they have to go to work. It's not a really good solution in every case. And finding somebody who can be helpful to you is a real challenge because there's no registry for most people. You can't just put your name on a list and have somebody call you who's necessarily going to be suitable for you. It's a very complicated, and frankly, I think unnecessarily complicated process. You've met many people who are trying to manage, and does anybody have a great solution that you can share with us here today?
You know, I think people work really hard to find a match. And as you know, you can't have one match. You often need several matches. And so I think it is hard. I think there are becoming more opportunities around technology and programs that are similar to, I hate to use the analogy, but similar to a Match.com, you know, where people can, you know, subscribe and have their information on a software, you know, platform that really talks about their strengths and what they can provide, and the member, you know, or the individual, you know, can then, you know, match to those by what they're looking for and somebody to support them throughout the day.
Well, for people who are watching and may be interested in that, there's a great model, in my opinion, in Massachusetts, and it's on the web. It's called Rewarding Work. And this particular group in Massachusetts matches people in much the same way as you were talking. But more importantly, their main objective is to find work for people who want to work. And so people who are wanting to work and open to learning about caregiving can log on. They can learn about this field. It's not a very well-defined field, but they learn what's involved as a caregiver, and they then can register their availability, and people then with disabilities and seniors can go on the website on the other side of the door and look to see who's registered, look at their qualifications, look at their interests, find out if they've helped somebody that they might be able to call. It's a wonderful model, in my opinion. In fact, we'd like to bring that program to Texas, and I think there are probably good examples in other states too.
Yeah, there's a program called My Support. There's a My Support platform, you know, that really does that. And of course, it gives people who are interested in providing supports for other people a world to test out and see what those responsibilities are, because people's needs throughout the day are so different. So it really gives them, you know, it's able to paint the picture for them of what, you know, all their obligations and companionship may look like.
Well, you know, there's a number of independent living centers around the country too that are trying to facilitate that matchmaking, if you will, help people with needs to find those who are in the market, the workforce, able to care for them. But it brings up another issue, and that is workforce issues. There probably aren't enough people who are willing to and interested in providing home care, home assistance, independent living services to seniors and people with disabilities to meet the need that we will soon have. The demographics show there's millions and millions of people who are baby boomers. Now, all of us baby boomers, and I fit the category, are turning retirement age or will be very soon, and as people age, they become disabled. The odds of having a disability, if one lives long enough, are pretty low. Most people do acquire a disability. It may be a hearing impairment, a vision impairment, or in many cases it is a physical impairment, and people do need assistance with home chores and other personal hygiene assistance as well. The workforce now is not developed. We don't have any way to train or orient people to this kind of work. There's no really well-organized system of employment training, matching, or anything of that nature. And it seems to me that it's incumbent upon us, and perhaps this is a role for the National Advisory Board that I chair for Merrill Group and for Anthem, perhaps that's a role for us. But I do think somebody needs to look at defining or visioning a community where these kinds of services are available and more easily obtained than they are now.
And I think, being able to get universities and community colleges and schools, to make this, available so that people look at, supporting people with disabilities and older adults as a career track, and as part of their lives. So I think when we do that and we bring that kind of light to it, hopefully we can build out, the workforce, because you're right that more and more people are going to age and more people with disabilities are living, longer, and people's lives take turns all the time. And so I think, we need people out there who want to support and learn how to support people according to their terms, so they can live in the community and do what they want to do.
Yeah, and I think it's important to point out these are not just volunteer jobs.
No.
People actually pay for this assistance. The people who provide the assistance are, find it in most cases very rewarding to assist another person, and you build a kind of natural bond between those folks. And it's not just young people who are doing it. Many older people who have full capacity are helping others, or people with matched capacities. Symbiotic kinds of relationships often develop. So it seems to me this is an area we need to work more on.
And I think those terms, and I use them as obligation and companionship. I mean, there are obligations. You have to show up on time as a professional, because the person you're supporting might need to be somewhere on time to catch a flight or show up to work or pick up their children. So, I mean, there is an obligation, but there is a companionship. They're very intimate tasks often, and a lot of time spent together. So I think it would be interesting for the National Advisory Board to look at, what we can do to advance that.
But I think every community needs to look at this because it's a community-based issue. It's in some respects, it's not a national issue. It's a neighborhood issue. Who lives in your neighborhood that needs help, and how do we ensure that those people are given the help they need so that they can be active, fully participating people in the community? I mean, with just a little bit of help, somebody who now is not able to work, somebody who's not able to be a functional part of the community can be. And that's, I think, the promise of long-term services and supports in the future.
I think, and the interesting thing also, about living in the community, if somebody doesn't show up to support you when you have a community, to rely on, like, if your car doesn't start and somebody comes to help you out or takes your kids to work for you that day, that you build those systems of support, in communities when you have the opportunity, to live there and make your friends in your world.
There have been some examples internationally. I've been in Japan and seen the neighbor-to-neighbor programs they have there. In Japan, many neighborhoods actually survey the neighborhood to see who's living there, what kind of help they need, and how to support them so they can continue doing that. And the neighbors work together to assure that there's somebody available to help those people when they need it. In fact, in Japan, most of that is voluntary work that's done. In Sweden, we saw some years ago examples of communities that actually located caregivers in the neighborhood fire department, right where the people who attend the ambulances stay, and they're on call. So somebody in the neighborhood needs help. They don't need an ambulance. They certainly don't want to go to the hospital. They just need help pulling their pants up. They can call the helper at the fire station who'll jog down the street and help them. That's another model. In Denmark, we saw examples of actually nursing homes that facilitated independent living in the communities around them. So people who had more needs perhaps, or who desired for some reason to live in that structured environment could be there, and those who didn't could live in the community, and the people who worked in the facility could also be dispatched to the community to help people there. Another interesting model. These are models around the world. I'd like for us to have more to talk about here in the U.S.
And I think it's interesting. I think it's a combination of things. There is your community that you can build when given the opportunity to live there, and then there's a system that we should be obligated to make that available to people, and those supports available as well. So I do think it's going to be a multi-pronged approach.
Well, the other issue is clearly financing. There's no program available. If people wanted to subscribe to long-term services and supports like they do subscribe to health insurance, for example, they really can't do that. There is a long-term disability program that some companies offer that has some subscribers. I actually subscribe to one of those insurance plans, but you know, they simply pay a number of dollars per day, and you can use that to pay your rent in a nursing home if you need to. It's not a very well thought out or well developed program at this point in time. So it seems to me that we need to figure out a method for financing that includes both private contributions and maybe some public subsidies. Maybe it's a community-to-community solution again, but whatever it is, we don't really have a profile for that. We don't have very good models to try and promote. So I think that's probably the first step.
Right, and I think, you know, you mentioned the Centers for Independent Living. I think, you know, we look to, you know, use those, you know, they could be used as models. Replicating money follows the person, community first choice, some of the waiver, you know, program benefits, and being able to expand those and offer them, you know, to people who would need them outside of the Medicaid system. But of course, it is resourcing. Right. Well, and you have federal and you have local. I mean, states are very responsible.
Here in Houston, people do call the Houston Center for Independent Living, and HCIL is able very often to find somebody who may help them. But I think the demand is greater than the ability to meet that that need at this point. Other people are in touch with the cities and the county's offices on aging who provide some assistance to them and have some programs. There's an ADRC in Houston that I think has the capability to make suggestions, but it's not a very well organized system.
Right. So we could always put that on our to-do list and our takeaway for the National Advisory Board. I think, you know, healthcare companies, managed care organizations, states, our federal partners, the Administration of Community Living. I think there are a lot of smart people, you know, who are very familiar with the issues and the benefits of some of these programs if they were resourced and replicable, that we could probably bring to the table for a pretty lengthy discussion.
Well, for the time being, it's a real challenge. So a person with a disability trying to live independently in the community, you know, people really have to use their imagination very often, and particularly I'm concerned about elders who fall and break their hip. Maybe they're perfectly able one day, they break their hip. The protocol in the emergency room may not be to go through the extensive repair and rehabilitation necessary, and they may simply be referred to a nursing home for lifetime care at that point in time. That's really not right. People should have the option of going back home, and there should be a system in place that could provide assistance to them in their own homes just as well as they could in an institutional setting. They don't need to be, you know, they have all their faculties available to them. They don't need somebody to care for them. They need somebody to assist them with their self-care.
Right, and I think, you know, the AAAs, the area agencies on aging, just like the Centers for Independent Living, you know, the same barriers, you know, would exist on resourcing. But, you know, we talked a little bit about prevention, you know, before, and I think it's, you know, supporting people in their homes, and are there, you know, carpets tacked down, are cords out of the way, you know, really trying to prevent those falls, because we know that they happen, and there are certainly bigger issues beyond that support people to live, you know, in their
Merrill,
homes.
in your role as a national disability advocate, what would you advise people in communities? If people are watching this show and they want to get involved in solving the problem, would you refer them to local organizations? Would encourage them to reach out to Centers for Independent Living, see if they have a committee working on this problem, or to a local AAA or AARP group or something like that?
I think those are great ideas. I think, you know, our Centers for Independent Living, the AAAs, the area agencies on aging, the ADRCs, the Aging and Disability Resource Centers, I think everybody, would be willing to take those calls. I think even our state agencies would be willing to take those calls and say, how can we better build these, capabilities in the community so that people have these opportunity with both formal and informal supports, that they're comfortable with.
Well, I do think it's important for people to be able to meet and talk with others who have similar issues and maybe other creative ideas about how to solve the problem that extend beyond their own personal needs. That's one thing that I've always advocated, and that is if you have an issue, if you have a personal problem, and you solve it, share it with others because they need that help. And if you can't solve the problem, seek help from others. Together we can probably achieve more than we can individually. We've always done that in the disability movement, starting the independent living centers and then with the ADA. So it's probably the next major leap for us is to get into the area of systematizing and ensuring opportunities for people in the communities through long-term services and supports.
I think it's important to remember that healthcare is local, healthcare is personal, right? And your ability to be independent is as well. And so it's utilizing, all of those community-based organizations. They're so rich. Our grassroots advocacy organizations are rich with the resources and the connections, and we just need to help resource them.
Right. Merrill, thanks so much for having this chat today.
Thank you.
Thanks for helping to answer the question at the beginning of the show. And I look forward to working more with you and visiting with you, perhaps even more on Focus on Abilities. But for now, it's been a pleasure, and we've been glad to have you as our guest.
Thank you so much, Lex. It really was enjoyable and fun to spend time with you and have the conversations.
We'll be right back with the closing comments. You've been watching Focus on Abilities on HTV. We really appreciate the support we get from HTV in the city of Houston. I want to thank also our guest today, Merrill Friedman. We've talked about long-term services and supports. My suggestion is call the Independent Living Center, call the AAA, call the ADRC, call whomever you can think of to talk about these issues if you believe at some point in your life they'll affect you. I really appreciate you watching the show today. We'll talk more about the subject in future Focus on Abilities program, and I hope you're watching then. Thanks so much and have a great day.
Focus on Abilities was brought to you by Tier Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence, and the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.